And thanks for joining us tonight. A conversation about health beyond COVID-19, fixing a broken system exposed by the pandemic. We'll get into that shortly, but let's start tonight with our case numbers when it comes to the disease. We know that we are still 1,671. Nothing has changed from yesterday. 16 deaths, 188 recoveries. Now, the problem with this is that it has exposed serious critical challenges with our health system. The president himself, in his last address to the nation, acknowledged the problem, and he eloquently articulated it. Watch.
Just as the virus has disrupted our daily lives, it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Whilst maternal, newborn, adolescent health and nutrition remain our top priorities, we must pay increased attention to chronic non-communicable diseases such as heart diseases, diabetes, and asthma, which have proved to be the common risk factors for the 11 deaths we have recorded from the virus. It has highlighted the need to address mental health issues in the crucial role of emergency services, to which the new fleet of ambulances and drones are responding. We must emphasize preventive and promotive aspects of health in addition to care for the sick. The virus has also revealed the unequal distribution of health facilities, as we have tended to focus our infrastructure on Accra and one or two of our other big cities. But as we've seen, epidemics and pandemics, when they emerge, can spread to any part of our country. There are 88 districts in our country without district hospitals. We have
So that's the president there articulating the problem when he spoke to the nation on Sunday. Now, looking at that, he went on to list a host and a raft of things that he intends to do to fix the problem. Majority of that will focus on infrastructure. We know the concerns that the minority had already raised about the impossibility of some of the things that he said he's going to do. They've talked about the loans the government plans to get to fix the problem in itself being a challenge. They cannot materialize over the next year as the president had intended it to be. Now, the president's announcement has also resurrected the debate, I'm sure you've noticed, over abandoned health projects by governments over the last many years. There are a few of them in particular that had come into question. The Kumewu District Hospital is one of them. 7 projects started in 2014 that hasn't been completed. We also know that work has been abandoned for about 2 years due to funding challenges. Is a key thing that had also come up. We also know that a visit to the site has revealed that the entire building has now been taken over by weeds, which is a sad spectacle. On 2 occasions, bushfires swept through the area where the health facility is, and security guards had to act swiftly to prevent the fire from spreading to the concrete structure. If we go to Abetifi, hospital project there, also started in 2015, has stalled. The Takoradi Hospital, which includes an infectious disease center, started in 2014, but also has been abandoned. So there's a host of them. We know that the health minister has been responding to some of these concerns, rejected the suggestions it intends to abandon health projects started by the previous government. So there's a promise there to continue and finish those started by the previous government, but hasn't been completed yet. That is one of the problems that COVID-19 has exposed. The thing is, we knew the challenges existed, right? We knew. Just that a crisis has a way of exposing them and making it a problem that already exists, making it even worse, which is what we're seeing. Apart from the abandoned projects, there are a raft of issues wrong with our health system. I mean, we've seen the challenges that we had in the early days of the COVID-19. We're simply unprepared for it. We've seen how the challenges with taking care of patients, the ambulance situation, emergency health care. There are so many things wrong with our health infrastructure. And the president talked about it when he talks about the deficiencies. It is not just infrastructure. It is many, many things. And that's what we're going to explore tonight. Because don't waste a good crisis, they say. It is reminding us of what we lack. My question is, what do we have to do to prepare for the next pandemic? Because if there's one thing that has become so certain in the wake of this crisis, is that we've been told by the experts that it is not if, but when the next pandemic comes. Are we going to be ready for that? Because clearly we are not ready for this one, and we are so grappling with it. Are we going to be ready? Is our health system going to be ready for the next pandemic? And that's what we're going to be talking about, assessing the challenges and then laying a path going into the next pandemic and the health crisis, whatever that may be. Stay with us here on PMS. So after we return, we'll get into the details. And thanks for staying with us. My guest tonight is Dr. Titus Bayo. He is the Deputy General Secretary of the Ghana Medical Association. Also joining us tonight is Dr. Martin Ayanori, who is a health economist and researcher, health systems. I'm grateful that he could join us also tonight. And also joining us is Gabriel Benaku. He is the national chairman of the coalition of NGOs in health. And I'm also very delighted that we can also join Dr. Elias Sori, who's also joining us tonight. He is a former Director General of the Ghana Health Service. He was there many, many years, and so understands this particular conversation quite well. I want to start with you, Gabriel Benaku. Do you agree with the president when he said on Sunday that, quote, just as a virus has disrupted our lives, it has also exposed deficiencies of our healthcare system because of years of underinvestment and neglect? You agree with that? Hello, Gabriel. Okay, let's see if Gabriel can obviously hear me, but let's see if we could bring in Titus Bayo. Hello, Titus, can you hear me?
Yes, good evening. Yes, it is.
Yeah, hi, Evans, I can hear you.
Great. Okay, Gabriel's line is not stable. I want to go to Titus now. Titus, let me bring you in on that question. We all watched the president on Sunday. I asked the question earlier when the president said that the crisis has exposed the deficiencies in our healthcare system as a result of years of underinvestment and neglect. What did you think when you heard that?
I think, good evening to our viewers. I couldn't agree with him more. It is true that there's been years of underinvestment in our healthcare system.
Yeah, I can hear you,
and
Stephen.
He aptly put it right. So I agree with him, and I am happy in particular that at least the president himself has come to this realization and has therefore decided that more attention needs to be given to this sector. And that is good news.
Let me bring back Gabriel on that. Gabriel, if I'm assuming that, like Titus, you agree that this particular crisis we're in had exposed the challenges with our health system. I wonder, analyzing it, which challenges exactly would you say this crisis has exposed in our health system? Dr. Eliasori is joining me. Doc, can you hear me? Dr. Eliasori, can you hear me? Oh, okay. Both of them can hear me. Both Dr. Eliasori and Titus and Gabriel Benaku have challenges hearing me. Let me see if we can bring in health economist who's also joining us via Zoom right now. Dr. Martin, can you hear me?
Yes, Evans, I can hear you.
Okay, I was asking earlier about I'm assuming that you agree with the president when he says this has exposed our the deficiencies in our healthcare system?
Good evening to your cherished viewers at home. I cannot agree with the president more than this. I think that what the president did was to demonstrate that high political will and admittance that over the years the health system has been underfunded, it's been neglected, and based on this realization and based on the events that we are seeing at this period of COVID-19 and post-COVID-19, there's a need to do major investments. So I do agree totally with the president.
Okay, good. Let's dig into that a bit more. Dr. Elia, sorry, can you hear me now? Okay, obviously can hear me. Dr. Titus Barrow, you work in the health sector. You've been in there for years. When you say you agree with the president, give me your assessment. In which specific aspects of our health system has been badly exposed by the coronavirus pandemic? So,
Evans, I think multiple systems or several systems or aspects have been exposed. But one of them, for instance, is access to essential medicines. The other, it is our ability to respond rapidly from local sources to with logistics. You realize that in terms of logistics, like basic things like PPEs, we had to rely on an initial backlog of about 5,000 PPEs that were left over from the Ebola crisis. That was what we could rely on for our initial response before we kickstart local production and try to mobilize some. And you can imagine that if we had a sudden outbreak, that 5,000 would not even last us up to a week. And so that is one area that it showed clearly our deficiency. Now, when you come to our testing capacity, but for the mercy of our research institutions, the University of Ghana and the University of Kwame Nkrumah University of Science and Technology, KCCR, the nation would have been caught pants down as far as testing capacity is also concerned. And some of these research institutions had to start with their own resources, with their own reagents, to do the initial testing before any resources could be mobilized to go to their aid. So this is some of the areas. And then one of our most feared area was when we get to patients with critical to severe conditions. We still have not been challenged at that level yet. But most of us in the healthcare system know that when we think about numbers, higher numbers getting there, it sends shivers into our spines, because we know that our capacity to respond in terms of ICU care, it is very, very limited. So I think these are some of the areas that have been exposed. If you also look at isolation centers, we haven't even had up to 2,000 people, and we have to make do with makeshift centers. Communities are resisting, and it tells you the difficulty in trying to identify places to serve as isolation and treatment centers. So it is obvious from these that the level of investment in our healthcare over the years across government has not been enough.
I mean, Dr. Martin, do you agree?
Yeah, absolutely, Evans. I just to add to what Titus is raising, that's why the president admits that we need to build 88 new district hospitals. You ask yourself, what will be the essence of this? Because if we are actually living by the terms of the primary healthcare system, then we should not be complaining of having additional district hospitals. Because the bane of our primary healthcare system is right from the chips to our health centers and to our district hospitals. So if we still have a gap in terms of infrastructure at that level, that in itself speaks a lot. And I think that one of the things I also want to highlight, even though the whole discussion is about funding, is also that over the years, investments in health in Ghana has really been remarkably low. And I know that in Africa, governments have over the years made pledges and commitments to increase funding for health, but that has never materialized. If you look at our spending per capita income, is extremely low compared to even other countries like South Africa and then Rwanda. So I want to also say that one of the key things that we have really neglected over the past years is funding for our healthcare service. And like Titus said, where does this funding go? Funding for essential medicines, particularly also preparing our local systems by strengthening them in the wake of any pandemic that may occur. For example, you talked about abandoned hospitals where we have a hospital that is supposed to be for infectious disease control abandoned. Yet today we are in the middle of a pandemic. If this hospital was there, you know what it could have done as far as our mobilization efforts are concerned. So I also think that in terms of our laboratories, they have not also been well equipped. If you listen to the president's last address, he did indicate that the University for Health and Allied Sciences is one of the centers. So fortunately, my university now has been designated as one of the centers. That is a boost to people from the Volta region here and then the Uti regions, because now we have the capacity to increase testing. But we shouldn't have come this far, because every regional hospitals or all teaching hospitals by now should have well-equipped functional labs that are able to provide these basic services in the population. And even in the area of health workforce, across Africa, not only in Ghana, we still have huge workforce shortages. WHO estimates that for us to be able to achieve the universal health coverage goals within Africa, we need to be able to cover about 63% of our workforce. In Ghana, we have our own challenges in terms of meeting the various cadre of workforce that should be deployed. So there are so many of these things that we have created gaps and loopholes over the years, and this has come back to haunt us as far as this pandemic is concerned.
Well, I want to take a break. When we return, I'll hear from the former Director General of the Ghana Health Service, and I'll hear from Gabriel Benako as well. We've heard already the Titus Bayo with the GMA and Dr. Martin have laid out what specific challenges have been exposed. I'm very curious to know from Dr. Lesori, who has been in the Ghana Health Service for a while, what his own assessment is and whether or not these challenges are new to us or very known to us, and why haven't we done something about it over the years? What has been the challenge? Stay with me. It's live on PM Express. My guest tonight, Dr. Titus Bayo. He's the Deputy General Secretary of the Ghana Medical Association. Also with us is health economist and also researcher, health systems, Dr. Martin Ayanore. Also with us is Dr. Elias Sori. He is the former Director General of the Ghana Health Service, and Gabriel Benako, who is the chairman of the national chairman of the Coalition of NGOs in Health. Dr. Elias Sori, I mean, we had a challenge with your line earlier, but hopefully it has been resolved now. I was curious, having been at the helm of the Ghana Health Service for years, COVID-19, the president tells us, and already we've heard both the Titus Bayo from the GMA and our health economists agree that with the president that it has really exposed the deficiencies with our health system. What's your own assessment of how, I guess, unprepared we were as a country and as a health system for this particular pandemic?
Thank you very much for bringing me in. And thank you to the panelists who are on this program. Indeed, as has been seen all over the world, even the most advanced countries, this disease has come to expose the weaknesses in the system. And we cannot say we are not in the same boat. Indeed, the system, we've grown a lot. The glass is half full. We have brought it from perhaps zero to where we are, but we still have a lot to do. Infrastructure-wise, we wouldn't say we've not had good part of it, but there is a lot we have to still do, as has been exposed. We've been training personnel for some time now, but we still have a lot to do. We've been equipping our institutions, but we still have a lot to do. One thing I heard on your news, which is striking, has been there for a very long time. Mm-hmm. Projects that have never been completed. You go to health centers, I've been from the district to the national. You go to areas, health centers, and you see bungalows that goats and sheep are sleeping in, and the health workers don't get the right accommodation to stay in. Doctors and nurses had to do a lot of improvisation to be able to carry out their work. In fact, as a young doctor, we knew what it was in the 80s. You had to scratch your head in order to let people live. And so what is coming out now is really very, very important, because we have seen a challenge. And the challenge is huge. We are not going to use guns to fight each other. It is not guns that will kill. It is not bombs. It is a tiny organism that is going to kill. And it is going to come. And it is good we are discussing things now. And for me, I've been a technical person all my life. It is not politics we should talk about. But to speak the truth, politics has also harmed the health system, because we tend to look at how we can stay on instead of looking at how people will live and be able to combat diseases that are threatening us. And so if today this has come up, I hope we'll end up uniting more and identifying what we should put in. We've already identified some, but do it well so that the people in Ghana will have a better way of controlling or dealing with such a disease that will come. Perhaps one will come, not that perhaps, it will definitely come. We are invading the environment of other species that should live on Earth, and we expect that their diseases will come onto us, and we might not be well prepared. So it is a good time to really have a national discourse and make sure that we are all together to prop up the health system. As a regional director, I remember when I was the Interbecton, that is the new regional hospital, ultra-modern hospital that was commissioned in Cape Coast, was coming up. I decided that I didn't want health workers to wear their uniform, come into the hospital, work and go back into their houses with the same uniform. You come, you change, you go in, work, come back, change and go, and not take diseases to our system. There were so many other things that perhaps if we had started early, this would not have been a bigger problem. But this is the time for us to look at.
Yeah, I mean, and it's good to do the assessment. Now, I want to bring in Gabriel Benako. Gabriel, so the president did his own assessment, and he focused quite heavily on the infrastructural deficit. But Dr. Lesori talks about something about a persistent problem that we've been there for long, that governments don't finish projects in health. As we see, it's been estimated 1 billion cedis worth of projects scattered across the country uncompleted. And yet, in COVID-19, regions are struggling to find isolation centers, and they have to fall on schools. Communities are rejecting it. Meanwhile, we have dozens of health facilities uncompleted across the country that, if had been completed, could host these people that we want to put in isolation. I wonder what you say about that. What's your thoughts on that as we all grapple with the COVID-19?
Yeah, thank you. Good evening to your viewers, and good evening to the Minister of Health. I think I associate myself with the other points made, but I already jotted 7 points down. They have made some known, we are not a civil society against the president's announcement for 88 district-based hospitals and then 6 regional hospitals. We are, in fact, I remember you or one of your colleagues interviewed me just after the announcement, and I said, hallelujah, 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 3 times. So we are not against, we are in support of that. We have made our observation, and I will come to that. But there are 7 major reasons why our health system since 1998 have stagnated till today. And if we pick over the last 7 years, it's much more stagnated than before because we have increased in population, but we have done little in response to our population. Don't forget, every year Ghana gives birth to more than 1 million children. And therefore, if you have a population of about 10 years, it means that you have over 10 million in addition to the existing population. And therefore, you must do something very seriously. That is what we have been lacking. Ghana have violated the Abuja Declaration of making a budgetary allocation for 15% of national budget. And that has been a vicious cycle affecting infrastructure development. Equity is critical. We have not been able to respond to our constitutional mandate in ensuring that universal health is accessible, the human resources are equitably distributed. So it has caused a lot of vicious cycle of problems in that regard. We have not even used technology over the last 20 years. We have not even tried. It is COVID-19 that has brought forcing even the president to use Zoom and other platforms to talk to other colleagues within the West Africa sub-region. So we know that with this move, once the leadership have tried and see that technology works, it will help him to influence changes in the country. We have not utilized research. We have not invested in research. And no country has developed without investing in research and development. For example, there are so many things in Ghana that other countries come to learn, and they use it to help their health system. The 17 did the research in collaboration with other universities, and they use the finding and go and build their health systems. And then we sit here in Ghana, we are not using the research findings to do what we are doing. And in fact, one major thing, and I decided to specialize in. So if you notice the way I've been speaking over the last 7 years, you will see that I have always talked about social medicine. Social medicine has been neglected in Ghana. Most of the doctors who present, who lead the Ghana Health Service, who lead the Ministry of Health, do not even understand the need to come out with policies on social medicine. And social medicine is the order of the day. India is using it so well, and they have billions of population, but they are able to manage the population. The China is using social medicine so well. Even the UK and Americas, they are using social medicine. They even have faculties developing social medicine, indigenous knowledge that is very contextualized within the local community. That works, and virologists will tell you that even the virus we are talking about, they need to look at the virus influence within the local context and find ways of now dealing with it. So social medicine has been a critical issue that Ghana has never invested in it. Then the other issue has to do with the politics. Even when over the last 7 years, my experience has been that people call me behind the scene after talking on health issues, thinking that I belong to Party A or Party B. So everything about the health sector, people just think when you start talking about it, it means that you are supporting a particular party. That thinking even put people off, put experts off to really contribute to Mother Ghana in terms of policy influencing. And so let me put it clear to Ghanaians and to the politicians that COVID-19 has brought these weaknesses that we have supervised. Ghana's health system, as we speak now, is stagnated. Dr. Bayo is there, Dr. Eliasore is there, my colleague health economist is there. If you look at over the last 7 years of the health system in Ghana, it's stagnated.
Yeah, and I guess the president will hit the nail on the head when he talks about that. Well, let me bring in Titus Bayo. Titus, so for you, as a leader of the colleagues in medicine and doctors, what should be the priority in fixing the challenges that COVID-19 has exposed? Where should the priority be? It appears the president's priority is in infrastructure. What's yours, based on your experience working in the hospitals across the country?
All right. So I will associate myself with the submissions made by my colleagues and senior, Dr. Eliasori, and then go ahead to say that we must be looking at fixing a health system and not trying to do things in isolation. We will need to prioritize things, but we have to look at a systemic approach to solving these issues. I was misquoted when I said that we welcome very much the president's intention to build hospitals, but we should also look at the human resource component. And then people took it to mean that we said we're not interested in the hospitals. We welcome the hospitals. We welcome them because they'll improve universal access, universal health coverage. And at every district, everybody deserves a certain level of care. And so it's a good initiative. But it must be holistic. Holistic in the sense that we must think about human resource. We must think about access to medicine. In fact, I am very happy at some of the initiatives taken now. My only hope is that when this COVID-19 pandemic is over and our borders are open, we should not lift our foot off the paddle. Now we are asking for local production of PPEs. Emergency certificates have been issued for local production of essential medicines. How are we going to continue to support these things so that it's a systemic approach? The hospitals will come in, but our human resource is equally important. And I would like to see from now, as part of this policy directive, a clear direction that comes with staffing norms. How many doctors we hope to train over the next years? How many specialists in the various areas and categories? How many laboratory technologists or biomedical scientists? And every contribution into this kitty is useful. These ambulances that were brought have come at a very timely point in our care. I can imagine if we didn't have these ambulances coming in and in the current situation that we are. I live at a place close to one of the isolation centers, and I see the ambulances moving up and down, up and down. If it was in the previous times when we had only 57 ambulances, functioning ambulances, what would have happened? Yeah. So it is important that we don't neglect the contribution, but it should be holistic. So the hospital should come, the local capacity should be there. I think it was an embarrassment that when we had this COVID-19 outbreak in the country, look at the number of weeks it took us before our public health reference laboratories, whose main duty would have been to respond to such an initiative or such an outbreak, could start doing testing. And not all of them have even started. Yeah. So it is our research institutions which are not regularly on the budget of the Ministry of Health, not supported regularly by the Ministry of Health, that have to come to our aid. Meanwhile, the labs that were designated for emergencies like the public health reference labs could not respond simply because they've been underfunded over the years. Capacity in terms of human resource and then material resource was very low, and it had to take so much time to build up capacity there before they can respond. So I think these are the areas we should look at, but we should not slow down local production of medicines, of PPEs. That should continue.
I mean, that has started, I guess, is sustaining over the period. Dr. Eliasori, so clearly everybody agrees this has exposed it. I wonder, in fixing the broken system, though, we just heard what the GMA's set of priorities are. I mean, at least Dr. Titus Bayo. What for you should be the areas of focus going forward in trying to fix this system we have, the health system we have, in anticipation of the next big public health emergency?
Thank you. Let me say that when the president or someone higher gives his thinking, it behooves on the technical people to take that and work on. For instance, the president has talked about building hospitals. It will have been made clear to him that in building the hospitals, the hospitals will be equipped, they have to be manned, and training will have to take place to make sure that they are operationalized. So I expect the Ministry of Health and the technical people to sit down now and look at exactly how to operationalize these hospitals. One of the reasons why we don't complete, or when they are completed, we don't go in, is because we don't start operationalizing the institutions before we even start building. Indeed, if you are to build a hospital, for instance, the first thing you put up is not the hospital infrastructure. It is the infrastructure for health workers to stay in. Indeed, certain category of staff must be there. And when the hospital is to start building, the management should be part of the building process. So I believe what the president has said, the Ministry of Health will take this up and now start the operationalization. It is something that we started some time ago, and we've lost it. And I agree with the person who is from the NGO. Sometimes, as I said, the glass is half full. We've done something, a lot, but we've also let something to go. But let me also add that, in actual fact, what Dr. Bayo has said has always been what I've talked about. Radio stations have called me. We have got the capacity in Ghana, but we tend to look at things from outside, just like all the consumers want things from outside. We fail to see the strength that we have. Indeed, Ghanaian doctors are sought for outside. I remember when I went for training outside, where they said I came from, schools wanted to get me because they know of the kind of training people are given in Ghana, whether nursing, medicine, or whatever. We've got a capacity here. This disease has come, and we've realized that we can make ventilators at very cheap cost. If we are to operationalize hospitals and we don't use local capacity or local resources, we will take the money and go and buy one or two things, and the money will be gone, and we wouldn't have gone far. If we want beds, we have got metal works in Ghana. Indeed, as a regional director, I have commissioned structures that metalworks. I gave the metalworks people to make the bed for me. Why can't we use our resources? If we tend to go out, it will cost us a lot. Coming to research, which is true, not that the research stations are not there. They are there, but they are mostly funded by outsiders to do what they want.
Yeah.
When I was in Bolga, I used the veterinary laboratory in Pont Tamale to do man culture and sensitivity. They could produce vaccines for animals there. In Ghana, Noguchi has been able to sequence the genotype of the virus. It means we can produce vaccines. Just put a little more into local production.
Yeah, I mean,
in actual fact, with these new hospitals, I wouldn't be calling for 10 key projects. The 10 key projects can build 4 or 5 more, or complete 4 or 5 more. If we don't stress on this and stop looking at us as if we can't do anything, and people think that whatever is produced here is cheap, we'll continue to have these difficulties.
I mean, fascinating stuff.
Focus
fascinating
on
stuff.
how we are going to operationalize the system.
Yeah, I mean, Dr. Martin, it comes back to the investment. I wonder, let's talk about, for a second, how much investment, how much of the budget is going into funding health, or the health budget. I mean, how much of our GDP, how much of our budget is going into, what percentage of our budget is going into it? I mean, Gabriel Benako had mentioned that we are not meeting our international obligations. We said in Abuja, when we said we're going to devote X of our budget every year to health. We are funding far more education than health, sometimes in other areas than health. What should the ideal budgetary funding for health be, really, going forward, if we really want to be consistent and prepare a great health system for the next pandemic?
Yeah, thank you, Evans. I think I would want to agree with my senior colleagues on the other side on all the issues raised. Before I go to that, I want to quickly just add in a few things based on what they said. They talked about capacity resources, which is very important moving forward. There's one important fundamental thing that we have to do moving forward. We need to ensure that we adapt the health system's learning approach. So like they all said, what are we learning from this pandemic? So that the things that we are learning will inform us going forward into the next pandemic. It's very important for us as a country to do so. One of the things they also spoke about was politics and then health. As a health economist, my point of view is that health is politics, because there are school of thoughts that makes that strong argument. For us to have greater investments in health, it has to take a political will. It has to be political commitment. It is how we find the blend between politics and health that is the problem. So our discussion should be more focused on how do we strike a balance between greater investments in health as against other equally important things in other sectors that may require national governments to fund. So for us to be able to make greater investment in health, we need to apply political skills, we need to lobby, we need to advance our argument and make an economic basis why it is important to invest in health. And I think that countries that have spent or are going above the threshold expected in terms of their health funding are making those economic arguments. That's why they are advancing. So that's the point I wanted to make. I think one of the key things that we have to also look at moving forward is how do we ensure greater investments in our public health systems? Public health is really neglected. So we need to be able as a country to refocus our attention to public health.
Yeah, how much of our budget should we be investing in it then, if we really want to achieve what the president says?
Yeah, so based on previous agreements as a country, I think that if we still go by the Abuja Declaration, it will be phenomenal. 15% of our budget. However, that may be difficult to achieve in the short term as we are facing this pandemic. So I think that if we are able to up our investments to 10% of our GDP over the next 2 to 5 years, and then increase as we go along, it will be very phenomenal.
Okay, Dr. Martin, hold that thought. I want to bring in Gabriel Benako on that. Gabriel, do you agree 10% of our budget should go into health going forward?
Yes, actually, yes, I agree to him, but I've done some research around. The Ghana Health Service has a standard for hospital, and they have done some preliminary costing. And then when I picked that, I tried to situate it to the president announcement, even though government have not officially announced how much they have for that. but I can start with that. That can frame another discussion. Ghana will require about 14 billion to be able to put up the 88.
Did you say 14? Did you say 14 billion with a B or 14 million?
14 billion.
B dollars?
Yes.
Dollars.
Ghana will require that to be able to
$14 billion. $14 billion.
Yes. Ghana will require that by the Ghana Health Service. They already have some standard hospital costing, and I've cited the document and I've tried to do some mathematics around it, and I'm preempting them, and because that is one of the issues we talk about, the politicization. So my brother didn't understand the context in which I was talking about. You see, the Ministry of Health, with all the technical team Dr. Suri talked about, with the Ghana Medical Association, ought to have had some preliminary discussion to know how many health facilities are yet to be completed. How much do we need to complete those ones? Then how much will we require to add on the 88? How much will EV cost? And that would have been a very good presentation given to the president, so that it doesn't allow the president to talk and then it becomes a national debate about whether the president was right to announce or whether Ghanaians are spectators or they are citizens. And that is what tend to move away from the normal politics in taking decision to the just any politics. So when you talk, people think that, why are you against the president? And they don't know that what the president says, he's also accountable. We have constitutional provision. He must be able to convince and move everybody along. And if he can just talk without convincing, then it means that his team is not doing a good job for him to be able to convince Ghanaians. You see, change fails, 70% of change fails if you do not involve the whole system approach.
Yeah, and I guess that's where approach, I've heard
you will have 70% of population resistant at every given point in time. So the moment you want,
and it's so important, the point you make, Gabriel. We just run out of time on this that you made about carrying everybody along. If we are to fix the system for the next pandemic, everybody has to come along and understand what investments are and how we're going to raise the money to fix it. But I'm grateful, gentlemen, for joining me. This is a conversation that we'll have again as we'll continue to battle this pandemic. Grateful, Elasori and everybody else who join us on this conversation. Come your way, going into more discussions. Enjoy the rest of your evening. My name is Evans Mensah.